Hi students, welcome to Pediatrics Predictor series, and what I'll do is I'll tell you important topics and I'll tell you solutions from the current edition of the Nelson's textbook, which is the 22nd edition of Nelson's textbook. So today what I have is I have a very common case which comes in your exam. You will definitely get a patient, an infant, who will be varying between 2 to 12 months, who comes to you with bilateral symmetrical flexor contractions. You can say they're bilateral, they are symmetrical, they are flexor contractions. And they are typically, they're called infantile spasms or they are called salam seizures. So remember, you'll get a patient who has typical infantile spasms or salam seizures. Remember, EEG is very important. So what can you see on the screen here? You can see all over the brain. You can see symmetric all over the brain. They are symmetric chaos. It's a high voltage chaotic complexes all over the brain. So they are generalized high voltage chaotic complexes, which is called HIPS arrhythmia. Remember, HIPS arrhythmia is classic of infantile spasms. Now you should know what is West syndrome. In your exam, they will definitely ask you about West syndrome. West syndrome is not the same as infantile spasms. It is a triad. Remember, it's a triad of infantile spasms, HIPS arrhythmia, and developmental abnormalities, which can be delay or regression. So remember, it's a triad of infantile spasms, the typical EEG pattern, and developmental regression or delay. So remember, infantile spasms or salam seizures is a very important question for your exam. You definitely get a question on how do you treat HIPS arrhythmia, how do you treat West syndrome. So all of you should know that the drug of choice for infantile spasms, according to even the latest edition of Nelson's textbook, is intramuscular ACTH. The second line drug is vigabatrin. Okay, so in typical infantile spasms, the second drug of choice is vigabatrin, and the third line drug is ketogenic diet. However, if you have an infant with tuberous sclerosis, remember, for infants with tuberous sclerosis, vigabatrin is the first drug of choice. So listen to me carefully. Vigabatrin is the first drug of choice for infants with tuberous sclerosis and the second line of drug overall. Very important for your exam. So do tag me, do ask me any question on social media platform. Thank you.